Did you know that Crohn's disease was once thought to be very rare in India, but now we have been increasingly diagnosing Crohn's disease, and Crohn's disease comes under the umbrella term of inflammatory bowel disease. Inflammatory bowel disease has two diseases, Crohn's disease and ulcerative colitis. The commoner one is ulcerative colitis. Hi, I am Dr. Manjit Singh Paul, the Director of Gastroenterology from Max Hospital, Shalimar Bagh. The thrust of my talk today will be on Crohn's disease, and I'll be talking to you about Crohn's disease in brief. So what is Crohn's disease? Crohn's disease is a chronic inflammation of your intestinal wall. It can affect any part of your intestine, starting from the mouth going up to the rectum. But predominantly Crohn's disease affects the second part of the small intestine and the beginning part of the colon. Now if you see our intestine, it is divided into three parts. The innermost layer, where all the food absorption takes place, called the mucosa. The middle layer, which is the muscular layer, called the muscularis, and the outermost covering, which is called the serosa. Crohn's disease has got the capability of affecting all the three layers. So you can readily understand, if it affects the mucosa, it can cause ulcers. Ulcers can bleed. Ulcers can secrete mucus. If it involves the middle layer, that is the muscularis, it can cause strictures, it can cause narrowings, and it can cause obstruction. If it involves the outermost layer and all the layers, then it can form anomalous connections between the various parts of your intestine and other organs. So that is in a sense what Crohn's disease is. Okay, so now let us see, how does Crohn's disease differ from ulcerative colitis? Both come under the same umbrella term of chronic inflammatory bowel diseases. Ulcerative colitis starts from the rectum. It involves only the large intestine, and it affects only the innermost layer, that is the mucosa of the large intestine. Unlike Crohn's, it does not affect the muscle layer, it does not affect the outer layer, so it is easier to control as compared to Crohn's disease, and the amount of complications of ulcerative colitis are less. Number two, ulcerative colitis starts from the rectum and moves up continuously up to a variable difference, whereas Crohn's is a totally discontinuous disease. It may involve one segment, the other segment may be normal, it may involve the next segment, the segment beyond that may be normal, so it is a discontinuous disease as opposed to ulcerative colitis. Then the involvement extent. The Crohn's disease can affect the entire small bowel. Ulcerative colitis, as I've said, is limited to the colon. Therefore, theoretically, to cure Crohn's disease, one would have to resect the entire small bowel and the large bowel, which is not possible. Whereas to cure ulcerative colitis, one needs to remove the colon and the disease is cured. No more medicines are required. So this is the basic difference between ulcerative colitis and Crohn's disease. So please remember one more thing, that Crohn's disease is an uncommon disease. I would also call it a rare disease. There are far many more conditions like infections, like tuberculosis, non-specific ulcers, which can affect the small intestine and cause similar symptoms to Crohn's disease. So in these cases, we have to take all this into consideration before we can diagnose a person as having Crohn's disease, because treating for Crohn's and treating for infections are diametrically opposite. So one has to be very careful in making a diagnosis of Crohn's disease. Let us now go and see what could be the complications of Crohn's disease. It is important to remember that Crohn's disease will affect the younger population, say between 20 and 35 years of age, at which it is most commonly diagnosed. Now these are young adults who may be working, who may be having athletes, who may be in the family way, and who can be undergoing the normal day-to-day work. So Crohn's disease may present as a catastrophic emergency with obstruction. Crohn's disease can present with a sudden severe bleed. Crohn's disease may be present in a pregnant lady. So will she be able to take the normal medicines during pregnancy? Will she be able to continue with the pregnancy? Do we stop and abort her pregnancy? So these are the answers which are very important to know. The first and the foremost thing is a pregnant lady who's taking medication can continue to take most of the medications as these are consistent with a safe pregnant person's outcome. A person who presents with an acute emergency, say obstruction, should such a person be immediately operated upon? The answer is no. A young person can even present catastrophically with the intestinal obstruction. Now, should a person be directly operated upon, or should we try to manage this person conservatively? It is important to realize that Crohn's disease is an inflammation. So, inflammation can often be controlled with conservative treatment, and a person need not be operated upon immediately. So, this is one important thing. And second important thing is people who present with sudden severe bleed. It is important to diagnose that this patient has got a bleed because of ulcers, and these ulcers can often be treated by medical methods and not necessarily by surgery. Some patients of Crohn's disease can present with a massive gastrointestinal bleeding. Now the question is, should such persons be immediately rushed for surgery, or can they be managed on a conservative note? The answer is that one must try to manage conservatively and give medicines to prevent further erosions and bleeding, and these kind of patients often, like intestinal obstruction, end up being successfully managed without having recourse to urgent surgery. So today we learned about Crohn's disease, and we also know that it is fairly rare in India, but because of the population of our country, the absolute numbers are quite a lot. We are in fact worldwide only second to USA in the number of Crohn's disease patients we have. So as I've said, the severity may not be the same in all individuals. Some may get by with a mild kind of a disease. Others may have a very severe disease which requires hospitalization. So it is a spectrum of diseases, and the spectrum may be very mild to very severe. With this, I come to the end of my talk, and should you have any comments or anything to ask, please go into the comment box below. I'll be glad to answer your queries. Thank you.